Dr. Mark DuPéré, board-certified plastic surgeon. Breast surgery overall is likely the most performed procedure in the aesthetic world worldwide. Of all those surgeries, breast augmentation with implant is by far the #1 procedure. Breast surgery is a #1 procedure at the Visage clinic, along with liposuction, body sculpting, and facelifting procedures. When somebody chooses to undergo a breast augmentation procedure, I do like to meet 2 or 3 times with that person so that we can go over all the options available for my patient. Many things are important to discuss, and one of them is the type of implant we're going to choose, the location of the implant itself, the location of the incision, along with the recovery that needs to be discussed in depth with the patient. So in Canada, we have several types of implants available for our ladies. We have the Saline Implants, which are the water-filled saline implants, which have been around for many years. And we have the newer 5th generation of silicone cohesive gel implants. The 5th generation implants are very safe. They've been in Canada since about 2002, 2003. They come in various shapes and forms, most commonly the round and the anatomical so-called teardrop shape. The implants come either smooth surface or textured. So I have 3 examples of breast implants here to show you. First of all, we have a cohesive gel, silicone gel implant of the round shape, smooth surface. Here I have a round implant, again, cohesive silicone gel of a textured surface. And finally, I have an anatomical so-called teardrop shape implant, textured, also silicone gel. So when I meet with my patient, one of the key points to discuss is the location of the incision. The incision is commonly performed under the breast, just above the fold. The incision is approximately 4 to 5 centimeters in length, depending on the size of the chosen implant. Another option for the incision is around the areola. The areola being the flat brown disc around the nipple. The incision is commonly located at the margin between the brown and the beige of the skin, between 4 and 7 o'clock. The third location for the incision would be in the underarm area, within the hair-bearing part. This incision is reserved for a particular group of patients where we have a known history of bad scars. The pros and cons for each incision is discussed with the patient, and the decision is taken together. Another important consideration, which I discuss with my patient, is where the implant will be positioned. The various options include under the pectoralis muscle, which we commonly refer as a subpectoral or submuscular plane. A second location is under the gland, so we call it a subglandular plane. And a newer version is what we call a subfascial plane. The fascia is a thick, strong layer above the muscle. It is helpful to put the implant behind that piece of fascia to keep it from moving down with gravity. It also avoids some distortion of the implant when an implant is put under the pectoralis muscle. Now, there are cases where we do put the implants behind the muscle, and in those situations, I do perform the dual plane technique. So in summary, breast surgery is complex but fascinating. So it is very important for you to choose a plastic surgeon who has a strong interest in breast surgery and who is board certified.